So now I want to describe to you how the team, and a really high-performing team, and the improvement methods work together. So here are some examples of projects, posters that some of your predecessors have done on the collaborative. And the idea really is that if we all work together, we can build a more robust and resilient answer to a problem and then try it out so we all do it really well. That ideas can come from anywhere, that talking about them is good and a good start, but unless we actually do something, not a lot changes. And thirdly, that measuring progress as we are testing and trialing the ideas is very, very important. A lot of traditional change management is about spending a long time coming up with the perfect answer, implementing it, and then coming back after a long period of time, maybe 3, 6 months, a year, to see whether there's a difference in the outcomes or the outputs. And what we know is that humans find it hard to do things differently, and complex systems find it very hard to really change and stay changed. People often revert back to how it was before, or something happens that means they have to. And all those great ideas and best wishes that we had in the beginning are kind of lost in the ether, so to speak. So here are some pictures of your predecessors' hard work before, where they've had ideas, they've put them into action, they've measured progress, and they've got a bigger impact. You can see that people have been working on consistent information, reviewing their clinic formats, how they do the annual review, ongoing education, creating driver diagrams, measuring as they go, so they create these things called run charts. So in theoretical terms, as a comparison, is that, an audit is great, but we tend to underestimate all those things that have to go in that box on the audit cycle that says make change. We have to understand the system. We have to understand the variation in the system, why it works in some situations and not in others, and for some patients and not for others. We have to work with and create stakeholder engagement is a fancy term for it, but it means get everybody that needs to be involved, understanding why, and helping us come up with a great answer and making it the answer day in, day out. We have to get the right people on the team. We have to work often across several different departments or buildings or parts of our medical and healthcare system, never mind education and social care and families and their home environments. We need to know that improvement is happening. It's not just a change. Change is a change. But if a change isn't an improvement, it's got to be changed again and adapted, or we have to start all over again. Enthusiasm is tough to keep going because change is quite tiring, it's quite exhausting in normal circumstances, never mind right now. So enthusiasm, we can't just keep it going with chocolate biscuits and coffee. We have to keep it going with positive evidence that we're making a difference and embed the old way so that we know it's working. So what about teams? How do they work? We've done a little separate presentation on this, but I'm just going to reinforce the idea that, the leadership of the team, including the people who aren't at the meeting, but that you're reporting to, are committed to what you're doing, that you're aligned and you're working on your purpose, that the outcomes for patients and the experience for patients and their families is demonstrably better because you asked them and they told you. Not only that, ideally, it's demonstrably better for you working in clinical practice because it's more efficient, it's more effective, and you can see the impact that you're having on patients and their families. All these things are vital. So what we say to you is just think about these aspects of a high-performing microsystem, where we're looking at purpose, patients, processes, patterns, and we're working together to create really effective clinical practice and outcomes for patients.